Hello, everyone. My name is Heather Fabry, and I will be discussing why we should increase nurse-to-patient ratios for nursing homes. So question, would you rather live in a nursing home or die? So let's discuss the ratio. So in PA, the ratio is a 1 nurse per 20 patients. And this does not account for the patient's disabilities and need for help. So my experience with nursing homes is I had a grandfather in Westmoreland Manor with Alzheimer's. He was wheelchair bound and he went past the security gates, the main desk, and wheeled down to Route 119, which is a heavy traffic bound road, and was lucky to be caught by a police officer who happened to be driving around there, brought him back. My grand aunt was at the assisted living care nursing home with Alzheimer's. She was beat by another male patient that just came into her room. And we only found out because of the family's roommates. And my grandmother was in Loyalhanna nursing home for rehab for massive heart surgery. She was in for around 7 days and never received any form of rehab. We pulled her out for fear of her getting worse because she was starting to get sick. And how did the nursing homes respond to this? So my grandfather, they didn't know how he got out. That was just something they kept repeating. So again, when asked why there was no guard or anyone at the front desk, they just restated they don't know how he got out. My great aunt, my mother complained. She got the manager and was proceeded to be yelled at and somehow told it was her fault for the patient, my aunt, getting out. And my grandmother, they tried to keep her in the nursing home. We took her out of it so she could do the rehab at home. And my mother pretty much had to tell the lady in charge that they were killing her to let her go. And again, a note, 2 of these nursing homes are still active to this day, and none of them really did anything to really change or help the environment for the betterment of the patients. So again, let's discuss this. I believe the ratio of nurses to patients should be raised and should be as close to 1-to-1 as possible. And this would affect the quality of life for the nurses and their quality of care, also affect the quality of life and death for the patients. And again, it would affect the costs of money as well. And we're going to look at that. So what is the importance of nurses? What do they really do? Nurses are the eyes and ears of the doctors and the patients. I've heard this multiple times. So when what happens when there's not enough nurses and there's just less time to help those who need it, and this can lead to death in the worst case scenarios, especially in nursing homes. So nurses know what nurses need. So according to the research article, appropriate nurse staffing levels for U.S. nursing homes. Most reports of lacking staff come directly from the nursing staff. They stated, there's a heavy workload, and because of that, they are unable to provide basic care. For nurses, this leads to burnout, job dissatisfaction, and high turnover rates. So what would be the right amount of nurses per patient? So I'm using a hospital nurse here to compare this. Maureen Casey, nurse at Penn State Health Milton S. Hershey Medical Center, states that more than 4 or 5 patients to care for at a time is when conditions become unsafe. So the law in Pennsylvania is 1-to-20, is about 4 to 5 times greater than it should be. Let's talk about the quality in life and death for the patients as well. So with discussing that, we're going to talk about nursing home abuse. So nursing home abuse. Many people look at abuse as beatings, sexual assault, and many other of the worst cases of abuse, which again, these are the worst cases. We hear of these more often than the basic forms of abuse. So in nursing homes, abuse can be considered, not being able to go to the bathroom for long periods of time because you're waiting for someone, not getting bathed for days because you need help, not being fed properly, not having basic conversations. It's just basic needs that a lack of that for long periods of time is abuse as well. So what would more nursing staff do? So having more nursing staff would help prevent these forms of abuse, or at least report or stop them quicker than when they should be reported. Unfortunately, only 57.5% of major injuries of falls are reported at nursing homes. So here's one of my arguments. Would it really help to have more nurses? And again, we're going to look at the hospitals. So according to HAP, the Hospital Health System Association of Pennsylvania, there's no clear evidence to support that a stationary nurse staffing ratio leads to better quality of care, improvements in patient safety, or increased patient satisfaction. And that COVID-19 has showed us that hospitals need flexibility to ensure that they can adapt to quickly changing scenarios, not more mandates that reduce flexibility, drive up costs, and do not improve care. And there are many studies on this. So for increasing the ratios, one found that the risk-adjusted 30-day mortality and failure to rescue rates of hospital surgical patients increased by 7% for every one patient increase in nurse workload. So again, we want to decrease that by adding more nurses. Another found that having more nurses lead to cost savings due to reductions in hospital-acquired infections, shorter lengths of stay, and improved productivity. Again, I'm talking about hospitals, but these are all quite common in nursing homes as well. And then unfortunately, facilities often increase staffing just prior to the annual survey to improve their survey results and inflate their staffing ratings on Medicare Nursing Home Compare, which again, it's just one of those sad facts. So now let's talk about costs. I'm mostly talking about money because this is the big thing. So what's the average a person in a nursing home is going to pay in Pennsylvania? So $10,038 for a semi-private room. That's a room with a another person in it. This is monthly, and it's $120,456 yearly. $10,828 for a private room for a monthly cost, and then $129,936 yearly. Compared to the national averages, which are listed, it's relatively high. But again, if compare it to anyone who, even yourself, if you own a home or apartment, most people do not pay anywhere near that amount monthly for a living area. So what about help for that? Medicaid and Medicare. That's what first came to my mind. So Medicaid will fully cover, but the person can only make $30,276 yearly. And they can only have $2,000 in extra assets. So that's like bank account. You can't have over $2,000, or they'll just take away that. They'll be like, you have to pay. Medicare only covers short-term stays in nursing home facilities following a hospital stay. So that's like my grandma had massive heart surgery and they put her in there to have rehab, which she never got. So the argument would be the cost increase for nursing homes themselves. So how much will it cost the nursing homes to increase staff? Unfortunately, nursing staff wages are considered one of the primary costs, and they are kept as low as possible to maximize profits. So let's look at the New Jersey's ratio. So again, with COVID happening, it's really opened everyone's eyes to issues in the medical field, and this involves nursing homes. So in New Jersey, they changed the ratios to 1:8 for a day shift, 1:10 for an evening shift, and 1:14 for night shift. So that one is, again, the nurse, and the other number is the resident. And let's look at what it costs them. So what's this price here? So the Healthcare Association of New Jersey stated it would cost $30 million, which that's a large number. But let's look at that spread out. So $30 million or $5 a day per resident. I did the math for everyone. So that would be $1,825 extra yearly per patient, or $152.09 monthly per patient, which could easily be added to the resident or the patient's bill if they so choose. So again, something to think about. New Jersey is definitely headed in the right direction, but the ratios are still low. So again, that 1-to-1 would be what we would be looking for. At least I would be looking for. And just to think about it, so is an extra $1,825 yearly added to what is paid for a nursing home worth it? So in conclusion, now you have the knowledge of what can occur in these nursing homes and why I believe we need to increase the ratio. And this would positively affect the quality of work done by nurses, quality of life and death of the residents, and again, just to look at the costs, it would increase the costs. So what can you do? So if this is important to you or your family, I recommend you contact your representatives, government officials, go vote, or maybe even run for office yourself. So with my presentation concluding, I'm going to ask you once again, now that we went through this all, would you rather live in a nursing home or die? Thank you.